Good morning to everybody who are listening to my lecture discussions on headaches. Today I am discussing on the cervical headaches. One insufficiently recognized cause of headache is irritation of one or more of the upper three cervical spinal roots or other branches. Justard and his colleagues described the strict diagnostic criteria for what they term cervicogenic headache. Unfortunately, in the view of these writers, the entity they have defined represents a very small proportion of headaches contributable to injury or irritation of the upper cervical spinal roots or their branches. An alternative label proposed for neck-caused head pain is cervical headache or upper cervical syndrome. Headaches caused by upper cervical spinal root irritation can be occipital, temporal, parietal, frontal or orbital. The pain can be a pressure, aching, steady or like a constricting band around the head. Sometimes a lancinating pain compounds the more steady pain. At times, the pain can be throbbing. Uncommonly, there are compounding migrainous features such as photophobia or nausea, retroauricular pain, and sometimes ipsilateral paresthesia of the lateral face are described. Rarely, there can be odd sensations of liquid dribbling or car riding, straining the neck, extreme range of motion movements, and sleeping, sitting up, all may trigger or exacerbate these headaches. Not infrequently, there is a history of recent remote neck injury. Maintenance of an awkward sitting posture, sitting for hours per day at a workstation, or recent involvement in vigorous, often jarring exercise, neurologic exam may reveal the signs of cervical spondylosis or myelopathy. Often there are paresthesias or pain in one or both the arms attributable to associate involvement of the lower spinal nerve roots. Tenderness of the greater occipital nerve at the base of the skull can be a hallmark of upper cervical root irritation. Headache caused by upper cervical radiculopathy can awaken the patient from sleep. Frequently, headaches are present on awakening, sometimes associated with an unrefreshed feeling, possibly resulting from multiple pain-related arousals during the preceding sleep periods. Nocturnal predilection may be related to excessive neck movements during sleep, irritating the inflamed edematous nerve roots. Furthermore, during recumbency, venous pressure in the neck vein is increased, possibly from the compression of the irritated spinal roots. Excessive neck movement during sleep may account for the increased prevalence of headache reported by some authors in patients with obstructive sleep apnea syndrome. Cervical spinal root irritation may also play a role in migraine because upper cervical spinal roots innervate the intracranial pain-sensitive arteries. Now we come to the end of my lecture session. I will come up with more information in my next lecture session. Thank you.